One Charlie Day from Day to Day Senior Care. How are you? Welcome to our part two of our great debate, regulation versus reality. All right. Since our first show, all right. Um, First, even before I get into this, I just wanted to thank everybody for attending last night. It's appreciated. We are going to go a little deeper into this tonight because I have a couple of things here I wanted to put up. All right, just to get us started. We only have 30 minutes, but if you remember, we had this, which was part of the Newsday investigation, where Long Island nursing homes were fined more than $500,000 for violations, including assaults. And then, if you look to your right, I'm posted on the screen now. Okay, New York governor declares disaster emergency as nurses walk out, and this was in January, and it's being extended, and it was extended in February. Um, so, look, we talked about the 500K in fines, but here's what Newsday didn't highlight. Okay. New York ranks near the bottom in the nation for nursing staff hours. Okay. Yet we have some of the strictest mandates around. Okay. So tonight we're talking about the compliance trap. All right. So here we are, we're trying to be in compliance. Nurses are walking out, CNA's shortage. Um, New York State demands 3.5 hours per resident, but with 2,500 New York State Nursing Association nurses recently protesting for safe staffing on Long Island, where are these people supposed to come from? Okay, I did further research. I looked at this ad. I looked at some other uh, things I just posted, and that's why why the headlines don't tell the whole story. That's the title tonight. I didn't even write the title in. I've just been coming straight from work, jumping in again. This is a special event. I don't normally do these on a Wednesday night, but I wanted to get part two in because I felt there were people yesterday. We had people that were viewing and listening, and I promised we'd come back and just get a little bit deeper into it. Okay, just a little deeper tonight, and I didn't have to go too far. All right. So we know from um, last night that there were some very, very serious allegations. Okay, and there were a lot of fines that are often issued because the facility was short one person on one shift, but it gets reported as a systematic neglect. All right, this is what New York State licensed nursing home administrators learn prior to taking their licensing exams with New York State. A lot of education and years of experience is required before you can get your license. Um, and unless you've got, your master's degree, then you can cut back on your experience levels. But I went the route from bottom to top. Um, but you know what? When you're looking at the regulations, you look in deeper. Newsdays just puts out, you know, the juice, okay? And then of course, I know reporting, we all know how reporting works. You want to put the most intense stuff at the top. So everybody's like, "Oh, it's the abuse, it's the, this that people, of fell, escaped or whatever it is." Okay. But now we got to step back. We got to step back and see how this all came to be. Okay? Now, when you're sitting with the state inspectors and they're in your building for a week or longer, there's a lot of back and forth. There's a lot of looking, to see how where the system broke down. Was it the nurse's aide that called in sick and then there was a replacement? Was it the resident who inappropriately touched another resident and then they took care of it and somehow he slipped away and got another resident? We want to look at how that happened. We want to see how we can correct it. The state requires plan of corrections, and we're supposed to be able to submit those after doing intensive investigations. So, you want to hear, you read one side, and that's why I titled it this, because you want to read one side. Newsday, yeah, that's fine. You know, the general public reads that and immediately jumps to conclusions that every nursing home, all the hundreds of nursing homes that are out here in Suffolk and Nassau County, that everybody's bad or the majority of them bad. Um, and that's not the case. A small percentage, okay, over the last couple of years, the state has gone in and now they put everything together for the last couple of years, and Newsday posts all these fines and the majority. I looked at that too. I broke it down and I looked at the fines from the state and the fines from the federal government. So when the state does their survey and they impose fines at the state level, I looked, some were 2,000, some were 8,000, some were 10,000. But then the federal government, when the feds come in and they do their survey, which normally doesn't happen on an annual basis. The only reason for feds to come in and do a survey with CMS is because something was triggered in either the state survey or a phone call or a resident's family member or something. But that's where the $100,000 for that serious alleged incident. And yeah, it was serious. The one where I have it right here. There were a couple of serious ones that really got nailed with the federal government. All right. So, failed to properly investigate or report allegations of sexual misconduct by staff. 138,000 in penalties. All right. Though that one's big. Cited for physical mistreatment by staff and failure to perform CPR. That's huge. That's $118,000. A resident, and this is another facility. This is three separate facilities. A resident with known suicidal ideation escaped through an unsecured window, suffering multiple fractures. Significant federal fines. Okay. So when Newsday posts the 500,000, look, let's look at it again. Let's take a look at this. Look, this is how reporting's done. Okay. And again, I am not trying to defend any of these serious allegations. They're serious, they're isolated, it occurred, and just like any professional, we would go back, we would read the plan of correction, we'd look at all the investigative reports, and then we could see how whether it was a systematic or isolated incident. And then we go from there, folks. And if you think that every nursing home in Suffolk and Nassau is going to be deficiency free, it's a perfect world. Like every restaurant you walk into, you're never going to get sick from the food you eat. It's going to happen. Okay. Anyway, I don't want to get off key here. Okay. So then there was also, where is it? One second. Yeah. So I looked at all of that. Let me get back so you can see. You see me down here. Okay. Let me get back to this one. And look here. New York governor declares disaster emergencies as nurses walk out. Okay. Executive Order 56 signaled a serious healthcare staffing crisis in New York. Folks, there's been a staffing crisis before COVID. Once COVID hit in 2020, it got progressively worse. It got progressively worse. And I was there during the COVID. I was an active licensed nursing administrator in a nursing home when COVID snuck in March. All right. I seen multiple people, multiple residents pass away during the first few weeks when it came through like a tornado. Okay. And everybody was traumatized, including myself. And if they weren't, then I don't know. But anyway, but ever since then, a lot of people don't, people look at the news article and they just, oh, well, the owners aren't paying enough. No, that's not the case. We lost half of the nurses during the COVID because New York State Governor Pataki, I mean Pataki, I'm sorry, Governor Governor Cuomo decided, okay, every nursing home is going to take COVID residents from the hospitals. So instead of putting them in the Javits Center or Trump's uh, huge ship that was sent out during Trump's first time in office, Instead, he decides, oh, yeah, let's just send them all to nursing homes. And he sent a letter saying that we need to take them. So here we go. We're doing what we can to mitigate COVID from spreading in the building. And now we're bringing in positive COVID residents with no vaccine. We're bringing them in, and everyone's getting sick, and people are dying. Okay. From staff to residents. It was tough. So when nurses were told that if they didn't get their COVID shots, they wouldn't be allowed to work after going through a viral war, that's what I'm going to call it, folks, a viral war. Okay, because we had an unknown virus in our nursing homes in New York State and throughout the nation that was 100-year uh, phenomenon. Okay, because this was unlike anything else that swept through these nursing homes. So we need to give the nurses a credit, all the credit, and all the staff get the credit for this. So when New York slapped them in the face and said, you know what, now you can't work in a nursing home unless you get COVID. Now this was after we had the vaccinations. They wanted us to continue the vaccines. Look, we there were other ways to work it out, and all the lobbying agencies, the New York nursing home associations, everybody lobbied to try to help the nurses, and it didn't work. Okay, so now you got that. So now years later, you want to bring all those nurses back? You want to bring them all back into the nursing homes? Ha! Half of them will never come back, and the other half, if they do come back, and then in isolated incidents like this, and this shows up on Newsday, 500, this, that, making it look really, really, really bad. I'd like to call out that reporter and have a discussion with him. Have him come on and sit down with me here, and him and I can talk it out. Okay, because you need to know both sides of the story, not just what they're reporting in Newsday on the front cover, making it sound like the apocalypse is coming again in the nursing homes. That was not the case. I went way off script, folks. I'm sorry. Let me let me go to what time we got left. Okay. All right. So I'm close. I'm on pace here. All right. We're near the 15-minute mark. So let's jump into the next thing. Let me ask you a question, and let me pull up my chat. If anyone's listening, I'm going to type in hello. So I don't know who's on looking who's streaming live. I mean, who's watching me live on Facebook, LinkedIn Live, or YouTube Live. But whoever's out there, um, I'm going to post hello, and then I'm going to ask a question. And if you want to answer it in the chat, if you want to join me and come on in, I've got space for at least 10 people. All right. But I'm going to open up. What did I want to show you? All right. Well, before I show you, let me read this. Okay. We saw Newsday mention medication errors. Is that a bad nurse problem or a one nurse doing the job of three problem? I'll read it again. If there's any nurses out there that are listening, but they don't want to jump in and talk to me here on our studio, that's fine. But if you want to chime in by chat, we're right there. Okay, you can just hit the comment button and type in. So again, the question is: we saw Newsday mention medication errors. Is that a bad nurse problem or a one nurse doing the job of three problem? Okay, I'll answer that. There may be a lot of people just waiting for the answer. I know I have viewers that have nothing to do with healthcare, but they could be potential client families that are interested, um, clients and our families that I always invite. It could be my friends from Connecticut. It could be my author friends. It could be my LinkedIn friends, my former peers just listening. What is Charlie doing nowadays? I can't believe this guy is talking all the time on the studio. But I'm having fun with myself, and I'm having fun with this growing place where we could really get out there and challenge things in today's world. And that's why I'm ready to challenge the Newsday reporter. He's welcome to come on anytime. I may even try and shoot him an email, see if he wants to do a debate with me. Um, but anyway, let's see. So, you know, let's talk about that real quick. The medication, is that a bad nurse problem or a one nurse doing the job of three problem? Okay. Yeah, many times you got one nurse on a floor, either a 20 or a 40 bed unit. You got one nurse or two nurses on you could have two nurses, okay, and a couple of CNAs, but that's still never enough, you know? It's not adequately staffed. Back in the days when I was working, folks, before COVID, we were overstaffed a lot of times. Okay, we had to put we would go around and we would say, you know what, you need to go down on the ground floor, go into the subacute unit. I'm going to send you over to the psych unit. We only have 16 residents here, and we've got five staff on the unit. Those were the days. I remember taking the whiteboard and trying to figure out where we could put all the staff because we got overage. We got too many staff. Those days are gone, folks. For now, will it change? I'm positive. I'm optimistic. But anyway, so now you got a nurse that's got a problem, trying to help someone that just fell out of bed. Another person's ringing the call bell because they got to use the bathroom. The other lady just walked out of a room. She's got some dementia. She's heading down the hallway. I can go on and on, folks. It only takes three, four, five residents, and you've got other aides changing briefs and putting them into bed, which is required, or another one who spilled all their dinner all over the floor, and she's looking for a housekeeper that's not available because that person's on another floor. So now she's got to clean it up. You see what I mean? Simple. So now the nurse gets involved in something and she made a medication error. Yeah, it's serious because it could contradict what medications need to be, given that time to it, that resident that may have had the medication error. And again, it's wrong. It's got to be corrected. But now we got to look at the issue of we need better coverage in that nursing floor. Otherwise, guess what, owners? We're not going to do an admissions until we have enough people for that floor. You can't bring any more patients up on that floor. That's how I would argue it. I've got 30 residents and I don't have enough staff. All right. So don't give me another 10 and I still have to work with the same amount of staff. Not going to happen. Oh, yeah, well, you know what? Then you're going to talk to admissions. We need staff. We need staff. We've got to pay our bills. Trust me, guys, we can pay our bills and still have adequate staff. We'll cut somewhere else. Give me your expenses list. I'll see where we can cut costs. Yeah, here we go. Let's take 5,000 off of marketing. Oh, you know what? You wanted to do this? Well, you know what? Let's hold off on that, on giving out those big bonuses to, I don't even want to get too deep into it, but trust me, it can be done. So anyway, next question. Okay, anyone wants to answer? The state is threatening a $2,000 a day fines for staffing levels. Okay. Does that money go back into care or does it just make it harder for you to hire more staff? Does any of my viewers, anyone watching tonight who works in nursing homes want to answer that question? Or if anyone else knows the answer to it? The state is threatening a $2,000 a day fines for staffing levels in the nursing home. Does that money go back into care or does it just make it harder for you to hire more staff? Folks, it doesn't go back into care. The government uses it, and yet you see articles such as this. Nurses, on January 9th, Governor Kathy Hochul issued an executive order number 56 declaring a state disaster emergency in Bronx, Nassau, and New York counties, as well as neighboring counties, due to severe healthcare staffing shortages. So you would think, instead of fining everybody all these exorbitant amount of money, maybe instead of fining, saying, look, here's an extra $10,000. Let's, show me all the information, give us all the prints, got to be accountable for the money the state gives you, and use it to pay staff more money per hour until you can get your staffing levels up. Work it out. Work a way to work at better rates to attract staff back. to fill those areas again. Okay, folks. Look, I'm seeing what's going on. I saw what went on back in the 90s. I started, like I said, in the 80s, early 90s. I was in family type adult homes, then assisted living, nursing homes grew bigger and bigger. Everything grew exponentially, and now the research I started seeing last year is everything is starting to change. People don't want to be in nursing homes anymore. People don't want to stay any longer than they can. They will do whatever it takes to either be home with their families. I mean, in other countries, families take care of each other. Hardly will you ever see, you know, what you see here in the United States. And look, I'm not knocking families. We're busy. Today's families are not like the families in the 50s. Everyone's working, husbands, wives, their kids. But still, you got to find time. If I look with my own mom. We hired some home care. We hired 2 people. We had 2 people eventually living in the house with her to take care of her because she had advanced dementia and she was starting to get aggressive, and eventually she got to the point where, you couldn't even get her into the shower without her swinging at you. And then we had to make the decision to put her into an assisted living facility. And I put her in with former peers that I knew in the business, 3 of them in administration, others in aid care, and they took care of her. Then they transferred her out. When I came back, uh, I couldn't get back in time. I was doing a gig up in Maine for almost 2 years, but my mom was placed in the Hampton Center nursing home where I had worked for many years, and I took care of her while I was there, and so did all the staff. And then when I left and went to another facility as the administrator, they still took care of. They still kept in touch with me and my uncle and my sister and my family until she passed. All right. So I've been on both sides. Okay. My mom went through it. I went through it. My grandfather had issues. All right. So let's move on. Okay. We're at the almost at the 25 mark. Any questions? Does anyone have any questions? Does anyone want to join in? We've got another 8 minutes left, folks. But if somebody joins in, I go into overtime. That's fine. All right. Again, everyone, I really appreciate you being on here tonight, listening to me discuss this. Let's go back over here. Okay, guys. All right. So now the action plan, the final part of this, I want to share. It's very important to me. Okay, we do need a narrative shift. We need the public to support funding for long term care, not just fines for it. Think about that. Okay? That's what I'm looking at here. Don't let the headlines win. Share this stream with let's show Long Island that we aren't just sited facilities. We are the backbone of the community. Okay? I am going to get in touch with the Newsday reporter. I'll try and get him on here. He can come on our Care with Confidence show. Um I'll let you know if I get him on, obviously. Um and then I want to take one moment. I have a letter here. I'm going to read to you real quick. And I'm going to circulate this around and I'm going to send it to the reporter too in an email. Okay. But this is an open letter. All right. A message to Newsday and the Long Island community. All right. I'll finish with this tonight. And then I'll keep you updated. To the editorial team at Newsday and the residents of Nassau and Suffolk County. We have read your reports. We have seen the numbers. 18 citations, over 500,000 in fines. We don't run from those figures, and we don't excuse the errors mentioned. Every resident in Long Island deserves dignity, safety, and a level of care that we, the professionals in this industry, strive for every single day. But your story is missing a heartbeat. Yes, It's missing a heartbeat. While you highlight 18 moments of failure, you are ignoring the 18 million moments of success that happened in these same facilities last year. You are ignoring the nurse who stayed 3 hours past her shift because of a resident's daughter couldn't make it to say goodbye. Okay? You are ignoring the aides who worked through the blizzard to ensure breakfast was served on time. You are reporting on the smoke, but you are ignoring the fire. The fire is a systematic collapse where the state demands 3.5 hours of care. That's okay per resident, but provides a Medicaid reimbursement rate that hasn't kept pace with inflation for years. Wake up, New York. You cite understaffing, yet you fail to mention the Long Island is facing its worst healthcare labor shortage in a generation. Yes, most of it because of COVID, the aftermath. When you fine a facility $100,000, $100,000, that money doesn't go toward a new Hoyer lift. It doesn't go toward a sign-on bonus for a new RN. It goes into a government coffer, further starving the very bedside care you claim to protect. We are not bad actors. We are safety nets for Long Island seniors, inside and outside the nursing home. We invite you to step out of the archives and into our hallways. See the care, feel the pressure, and report on the reality of long-term care, not just the receipts of the regulators. We aren't just an industry. We are your neighbors, and we aren't good anywhere. And we aren't going anywhere. Not good. We are not going anywhere. Sincerely, the Long Island long-term care community. Folks, I'll take care of that letter. I'll do my part. Please share this video. Present it in a class in your conference room. If I was working in the administrator's office right now, I'd present it. I'd have the staff come in. We'd get on. We'd debate. We'd post it social media. I'll have to go. I got an idea. 1 second, folks. I'll get in touch with a few of my peers in the nursing home industry. We'll get something together, and we'll go. We'll do a special event again. Hopefully, we'll send an invite to the to the Newsday reporter. We'll open up to any other families that want to know. They can chime in. All right. I know a lot of families have had, bad, you know, bad, results with nursing homes for their loved ones. So again, I have the strongest passion, and I offer my condolences. I don't ever want to see something like that happen. I've been in this industry for 3 decades. I know that I've seen a lot. Okay. So I can't say that it's a perfect world because it's not. But every time there was something that warranted me to do a termination or to call the state and let them know, I'd let the owners know that I was about to call the state. We'd hash out all the details, make sure everything was correct, and we'd get it done. Okay? That's how we take care of things. All right. Any questions before I go? Oh, yeah. And don't forget to subscribe to our YouTube channel if you like. This way you don't need to miss anything because we've got 3 series going on. We got a big night tomorrow night. Join us for our on the road special event tomorrow night. It's personal. You're gonna see it's just me, no guests tomorrow night. It's personal. I have something I want to share about my on the road series. I'm reaching out. I'll give you a hint. And I'm sure you guys have probably seen it either on on all my social media venues. But I'm reaching out to the heroes, the unsung heroes The nurses' aides, the nurses, the housekeepers, anyone that wants to go on and talk about their experiences working in long-term care, in hospitals. I'm doing hospitals too. I have a special event coming up next month. You guys are going to like it. It's going to be a Southside hospital, years of experience working there. I did like 12 years though. 12 years. I made a lot of friends, peers that I still in touch with on Facebook and everything. We've all gone our separate ways, but we were all aides back then, psych aides. And then we grew up and we became nurses and administrators, but that's going to be, I'm probably going to dedicate a few weeks on that one. But because we got a lot of people that want to chime on, and we're going to have a good event. But I'm going to reach out. I got to get going. It's over 30 minutes. I'm going to reach out, and we'll do some more about this. All right. I'll keep you guys updated. I can't even tell you what's to come. If I get that Newsday guy, I'll definitely be tweeting it. I'll definitely be sending that out. You can see I'm old school. All right, everyone. Have a great evening. Thanks for stopping by.